I need to tell you about a patient I'll call Margaret. 73 years old, sharp, independent. Walked her golden retriever every morning at 6:30 without fail. Cooked Sunday dinner for her grandchildren nearly every week. Her neighbors described her as the most active person on the street. Her GP described her as one of his healthiest patients in her age group. 6 weeks before I met her, something changed. She couldn't describe it exactly. She tried. She sat across from her family doctor and said, "Something feels off. I can't tell you what it is. I just don't feel like myself." Her doctor ran blood work. Normal. Her EKG looked fine. Blood pressure was acceptable. Cholesterol within range. By every conventional measure, Margaret was healthy. He told her it was probably stress. Maybe she wasn't sleeping well. Maybe she was overdoing it with the grandchildren. She nodded. She went home. She kept walking her dog. She kept cooking on Sundays. She kept feeling off. 3 weeks later, Margaret had a major heart attack. She survived, but barely. And the margin between surviving and not was thinner than I'd like to tell her family. When I reviewed her case afterward, I did what I always do. I went back. Through every detail, every visit, every note, every symptom she mentioned in the weeks before. And what I found was what I almost always find in cases like Margaret's. Her body had been sending signals. Clear, consistent, unmistakable signals. For weeks. Signals she noticed. Signals she reported. Signals that were missed because they didn't look like what anyone expected a heart warning to look like. My name is Dr. Langford. I'm a cardiothoracic surgeon. I've spent over 25 years operating on hearts, repairing arteries, and working to save lives in the most urgent circumstances medicine can offer. And I can tell you something with absolute certainty based on everything I've seen in those 25 years. The heart almost always warns you before it fails. The problem is that those warnings, especially after 60, especially in women, look nothing like what you've been taught to expect. No clutching the chest, no dramatic left arm numbness, no Hollywood collapse in the middle of a room. Those presentations happen, yes, but they are not the most common presentation in older adults. Not even close. The real warnings are quieter, stranger, more ordinary, and far more common than anyone realizes. They hide in symptoms that feel like aging, like tiredness, like stress, like something you'll get over next week. Today, I'm going to show you 5 of them. 5 warning signs your body may be sending right now, weeks before a serious cardiac event. If you're over 60, or if someone you love is over 60, stay with me. Because recognizing even one of these could be the difference between catching a problem early and discovering it too late. Before I walk you through the 5 signs, let me explain briefly why the heart warns you at all. Because understanding the mechanism helps you recognize the signal. A heart attack doesn't happen out of nowhere. It's the final event in a process that's been building for weeks, months, sometimes years. Inside your coronary arteries, plaque accumulates. Fatty deposits mixed with inflammatory cells, calcium, and fibrous tissue, building up along the vessel wall. For a long time, that plaque sits there. Your blood flows around it. You feel nothing. But at some point, the plaque becomes unstable. The surface develops cracks. The fibrous cap that holds it together begins to thin. And before it ruptures, before the clot forms, before the artery blocks completely, the blood flow through that narrowing vessel is already compromised. Not blocked. Compromised, reduced. Your heart is receiving less oxygen than it needs. Not zero. Less. And that partial reduction, that slow starvation of the heart muscle, is what produces the warning signs. Your body detects the shortfall. It compensates. It redirects. It signals. It's telling you something is wrong. Not catastrophically wrong yet, but wrong. The tragedy is that most people either don't recognize those signals, or they recognize them and explain them away. And by the time the plaque ruptures and the full blockage occurs, the window for early intervention has closed. That's what this video is about. Keeping that window open. Warning sign number 1. Unusual, unexplained fatigue. Not the tiredness you feel after a long day of physical work. Not the general slowing down that comes naturally with age. Not the heaviness you feel when you haven't slept well. This is different, and the difference is important. This fatigue arrives without a proportional cause. You slept 8 hours and woke up feeling like you didn't sleep at all. You walked to the mailbox and needed to sit down afterward. You climbed a flight of stairs you've climbed 1,000 times and your legs felt like they belonged to someone else. Tasks that required no thought 3 weeks ago now require effort and willpower that seem absurd for what you're doing. Here's what's happening inside your body. When a coronary artery is gradually narrowing, the heart receives less oxygenated blood with each beat. It can still pump, it can still function, but it can't pump as efficiently as it did before. The output drops, not dramatically, subtly. And your body, remarkably intelligent as it is, compensates by redirecting blood flow. Essential organs get priority: the brain, the kidneys, the heart itself. What gets deprioritized? Your skeletal muscles, your general energy supply, your reserve capacity for effort. You feel that deprioritization as fatigue. Bone-deep, unexplained fatigue. But you don't connect it to your heart because you're not having chest pain. You're not short of breath at rest. You're just tired. And everyone over 60 is tired sometimes, so you explain it away. Here's what the research says. A landmark study from the National Institutes of Health examined women who had experienced heart attacks and asked them about symptoms in the weeks and months before the event. 71% reported unusual fatigue as a prodromal symptom. 71%. It was the single most commonly reported warning sign. More common than chest pain. More common than shortness of breath. More common than anything else on the list. And it wasn't reported only by women. Men experience it too. But men are more likely to push through it without mentioning it to anyone, which makes it even more dangerous in that population. If you are over 60 and you experience a sudden, persistent change in your energy level that has no clear explanation, do not wait for it to pass. Do not tell yourself it's just age. Mention it to your doctor specifically. Ask for a cardiac evaluation, a stress test, blood work including troponin and BNP, an echocardiogram if warranted. Fatigue is easy to dismiss. That's exactly what makes it deadly. Warning sign number 2, jaw, neck, or upper back pain with no obvious cause. When most people think of heart-related pain, they think of chest pain, chest tightness, pressure behind the sternum. And yes, that can absolutely be a sign of cardiac distress. But after 60, and particularly in women, heart pain frequently shows up somewhere entirely different. The jaw, the neck, between the shoulder blades, the upper back. This is called referred pain, and understanding why it happens helps you recognize it when it does. Your heart doesn't have the same kind of pain receptors your skin does. When the heart muscle is in distress, when it's not receiving enough oxygen, it sends pain signals through the vagus nerve and the cardiac sympathetic nerves. Those nerves feed into the same spinal cord segments that receive signals from your jaw, your neck, and your upper back. Your brain receives the signal and interprets it, but it can't always tell the difference between a sore jaw and a struggling heart. So it assigns the pain to the location it knows best, the musculoskeletal structures it's been receiving signals from your entire life. The result is that you feel jaw pain, or a stiff neck, or a burning ache between your shoulder blades, and you go to the dentist, or the physiotherapist, or you take a painkiller and assume you slept in a bad position. I've spoken with patients who spent weeks treating dental pain that had no dental cause. Others visited chiropractors for neck stiffness that no amount of adjustment could resolve. One woman told me she'd been icing her upper back every night for a month. The pain was real. Her heart was the source. Here's what to watch for specifically. Pain in the jaw, neck, or upper back that appears with exertion and fades with rest. That pattern, onset with activity and relief with stillness, is a classic anginal pattern. It means the pain is linked to increased cardiac demand. Pain that arrives suddenly without any injury, fall, or obvious musculoskeletal cause. And pain in any of these areas accompanied by mild nausea, sweating, or shortness of breath. Any of those combinations in someone over 60 warrants a cardiac evaluation. Not next month. Not when you get around to it. This week. Have you ever had unexplained jaw pain or neck stiffness that seemed to come from nowhere? Write that in the comments. I want to know how many of you have experienced this and never connected it to your heart. Warning sign number 3. New shortness of breath during ordinary activities. Walking up a flight of stairs you've climbed 1,000 times and suddenly needing to stop halfway to catch your breath. Carrying groceries from the car and pausing at the door because you're winded. Getting dressed in the morning and feeling like you just finished exercising. This is not normal aging. This is a signal. When the heart can't pump blood as effectively as it once did, whether from reduced coronary blood flow or from the early stages of heart failure, fluid begins to accumulate. Specifically, blood backs up into the pulmonary circulation, the vessels in your lungs. The lungs become slightly congested. Not dramatically, not enough to cause respiratory distress at rest, but enough that when demand increases when you climb stairs, carry weight, or exert yourself even moderately, the lungs can't exchange oxygen efficiently. You feel it as breathlessness. Here's what makes this warning sign particularly dangerous. Most people over 60 expect to become more winded with age. They normalize it. They slow down. They avoid the stairs. They take the elevator. They sit more. And every accommodation masks the underlying problem. The decline becomes invisible because they've adjusted their life to accommodate it. The distinction I need you to understand is this: a gradual, slow decline in exercise tolerance over years where you're slightly less fit each decade that can be normal aging. A noticeable change over weeks or a few months, where activities that were comfortable 6 weeks ago now leave you breathless, that is not deconditioning. That is your heart asking for help. And there's one specific variant I need you to watch for because it's particularly telling. Shortness of breath that wakes you up at night. If you find yourself suddenly sitting bolt upright at 2 in the morning, gasping for air, or if you've gradually started needing more pillows to sleep comfortably, or if you wake up with a sensation of suffocation, that is fluid accumulating in your lungs when you lie flat. It's called paroxysmal nocturnal dyspnea, and it requires immediate medical attention. Not next week. Tomorrow morning. Call your doctor. Warning sign number 4. Persistent digestive symptoms that don't respond to treatment. This is the one that gets missed most often because almost nobody, connects their stomach to their heart. But the connection is anatomically direct and physiologically powerful. Persistent indigestion that doesn't resolve. Nausea that comes and goes without dietary explanation. A feeling of fullness or bloating after eating very small amounts. Heartburn that antacids can't touch. Loss of appetite that arrived suddenly and won't leave. The heart sits directly above the diaphragm, directly above the stomach. When the heart is under stress, when it's struggling with reduced blood flow, the vagus nerve, which innervates both the heart and the entire gastrointestinal system, sends signals that the brain can interpret as digestive distress. You feel sick to your stomach. You feel bloated. You reach for the antacids, and they don't work because the problem isn't in your stomach. It's 6 inches above it. I've spoken with dozens of patients over the years who told me, in hindsight, that in the days and weeks before their cardiac event, they thought they had a stomach bug, or food poisoning that was taking forever to resolve, or a new food intolerance. They treated the symptoms. They ignored the source. Because who thinks about their heart when their stomach hurts? In one major study examining pre-heart attack symptoms, nearly 40% of patients reported gastrointestinal disturbance in the weeks preceding the event. 40%. That is not a rare or obscure warning. It's common, and it's almost universally misattributed. If you're over 60 and you develop persistent digestive symptoms with no clear dietary cause, symptoms that don't respond to antacids or dietary changes within a week or two, ask your doctor one question. Could this be cardiac? That single question redirects the clinical thinking. It opens a door that might otherwise stay closed until it's too late to walk through it calmly. Warning sign number 5. A sudden, unexplained sense of anxiety or dread. This last one is the hardest to talk about because it sounds vague. It sounds psychological. It sounds like something you should push through, take a deep breath, and get on with your day. And I need you to hear me very clearly when I tell you that this symptom is as physiological as a blood pressure reading. There is a mechanism behind it. and it is one of the most consistently reported warnings before a major cardiac event. When your heart begins to struggle, when cardiac output drops even slightly, blood flow to the brain is affected, not enough to cause obvious neurological symptoms, but enough to trigger the brain's deep alarm systems. The limbic system, your brain's threat detection center, registers that something is wrong. Oxygen delivery is slightly off, metabolic signals are slightly abnormal, and it generates a response that you experience as a feeling of impending doom. That phrase, impending doom, appears in medical textbooks. It's that specific. It's that recognized. Emergency medicine physicians are trained to take it seriously when a patient reports it because it so frequently precedes a major cardiovascular event. Patients describe it with remarkable consistency. I just felt like something terrible was about to happen. I couldn't shake this sense of dread. I woke up at 3 in the morning with my heart pounding and this overwhelming feeling that I was dying. Everything looked normal, but nothing felt normal. This is not anxiety in the psychiatric sense. This is not a panic attack, though it can feel like one. This is your brain detecting a genuine physiological threat and doing exactly what it's designed to do, sounding the alarm so loudly that you can't ignore it. And yet people ignore it because it feels embarrassing, because they don't want to seem dramatic, because they tell themselves, it's just stress, it's just nerves, I'm being silly. Particularly men. Men are taught to push through feelings like this, and that cultural conditioning costs lives. If you experience a sudden onset of unexplained anxiety or dread, particularly if it's accompanied by any of the other symptoms we've discussed today, fatigue, breathlessness, jaw pain, digestive changes, do not dismiss it. Do not tell yourself you're overreacting. Your body is telling you something urgent. Listen to it. Act on it. Call your doctor. Go to the emergency room if the feeling is intense. I would rather you go to the ER and be told everything is fine than stay home and find out the hard way that it wasn't. Let me bring all 5 together. Unusual, unexplained fatigue that doesn't match your activity level. Pain in the jaw, neck, or upper back, especially with exertion. New shortness of breath during activities that were previously comfortable. Digestive symptoms that persist without explanation and don't respond to standard treatment. A sudden, overwhelming sense of anxiety or dread that arrives without a psychological cause. These 5 signals are your body's early warning system. They are the advance notice your heart gives you before a crisis. The tragedy I've seen over and over across 25 years of surgical practice, is not that these warnings don't exist. It's that people experience them and dismiss them, explain them away, wait for them to pass. And by the time they act, the window has narrowed dramatically. Here's what I need you to do with this information. 2 things. First, remember this list. Write it down if you need to. Put it on your refrigerator. Save this video. Share it with the people you love. Because the person sitting next to you, the friend you have lunch with, the sibling you call every Sunday, the spouse sleeping beside you tonight, they need to know these signs as well as you do now. A heart attack is not just the patient's emergency, it's a family emergency. And families who know what to watch for are families who act faster, and faster action saves lives. Second, if you recognize any of these symptoms in yourself right now today, make an appointment. Not next month, not after the holidays. This week, tell your doctor exactly what you're experiencing. Be specific, be persistent, and ask directly for a cardiac workup, a stress test, an echocardiogram, troponin levels. Don't leave it to chance. Don't assume it's nothing. Advocate for yourself the way you would advocate for someone you love. And here's what gives me genuine hope. What keeps me making these videos instead of just operating and going home. When these warning signs are caught early, the outcomes change dramatically. A narrowing artery caught at 70% blockage can be treated with medication, with a stent, with lifestyle modification. The same artery at 99% blockage is a heart attack waiting to happen. Early detection doesn't just improve outcomes, it transforms them. It's the difference between a medication adjustment and open heart surgery, between a conversation in an office and a crisis in an operating room. Margaret survived. She recovered. She's doing well now. She walks her dog again. She cooks for her grandchildren again. But she told me something during one of her follow-up visits that I carry with me every day. She said, "Dr. Langford, I knew something was wrong. I felt it in my body for weeks. I just didn't think my heart would warn me in that way." Your heart does warn you. It warns you clearly, consistently, weeks in advance. It warned Margaret. It has warned thousands of my patients. And if it's warning you right now today, I hope this video helps you hear it. Which of these 5 signs have you or someone you love experienced? Tell me in the comments. I read every single one, and I respond to as many as I can. Your experience matters. Your story might help someone else recognize what they've been missing. And please, I'm asking you personally, share this video. The person you share it with may be experiencing one of these warning signs right now, tonight, and explaining it away the same way Margaret did. Your share could be the thing that makes them pick up the phone and call their doctor. That single act of sharing could genuinely, literally save a life. I don't say that for clicks. I say it because after 25 years of surgery, I know exactly what happens when warnings are ignored. And I know exactly how different the outcome is when they're caught. Subscribe if you want honest, evidence-based information every week from someone who has spent decades inside the operating room and who makes these videos for one reason only, to keep you out of it. No products, no sponsors, no supplements to sell. Just the truth spoken clearly about the body you're living in. Take care of that heart. It's been talking to you your whole life. It's time to listen. And one last thing. Everything I've shared today is general medical information based on published research and my clinical experience. Every person's body is unique. Every situation is different. Before making any decisions about your health, please have a full, honest conversation with your own doctor. They know your history, they know your medications, they know your body, and that conversation, specific to you, informed by what you've learned today, is exactly where life-saving medicine begins. Take care of yourselves. I'll see you next week.